Which of the following statements is true about patients undergoing anesthesia? A. Very young patients should not fast for long before anesthesia because they could become hypoglycemic. B. A dog in good health cannot consume food or water for 12 hours before undergoing surgery. C. Patients undergoing joint surgeries generally have to fast longer than patients undergoing abdominal surgeries. D. Most normal, healthy patients have to fast for about 4 hours before they undergo surgery. Answer A. Very young patients should not fast for long before anesthesia because they could become hypoglycemic. Which of the following instruments would a surgeon use for ligation of stumps or pedicles? A. Halsted mosquito hemostatic forceps. B. Rochester Carmalt hemostatic forceps. C. Doyen intestinal forceps. D. Babic intestinal forceps. Answer B. Rochester Carmalt hemostatic forceps. Which of the following is a correct statement regarding subcutaneous injections? A. The effects are felt 15 to 20 minutes after the injection. B. This area contains a small supply of blood vessels. C. The area below the skin surface has many nerves. D. Only non-irritant drugs should be administered this way. Answer D. Only non-irritant drugs should be administered this way. Within which part of an image-intensified fluoroscopic system are X-rays converted into visible light photons? A. Output fluorescent screen. B. Image intensifier tube. C. Electrostatic lenses. D. Fluoroscopic tube. Answer B. Image intensifier tube. Which of the following anesthesia drugs is most often injected? A. Isoflurane. B. Ether. C. Halothane. D. Morphine. Answer D. Morphine. A correct statement regarding a common dental instrument called a curette is: A. It has 2 blades and 1 cutting edge. B. It is used to remove subgingival calculus. C. It cannot be used for removal of soft tissue diseases. D. Its cutting edges cannot be used on the back of the tooth. Answer B. It is used to remove subgingival calculus. While conducting wildlife research, scientists may discover an animal, such as a wild bird, that needs immediate medical attention. Which of the following procedures would a surgeon be least likely to perform on a wild animal? A. Laparotomy. B. Flight restraint. C. Sterilization. D. Dental prophylaxis. Answer D. Dental prophylaxis. Hemolysis occurs when red blood cells break and release their contents into blood serum or plasma. All the following are causes of in vitro hemolysis except: A. Osmotic pressure. B. The size of the needle. C. The separation of plasma. D. Vigorous shaking of samples. Answer C. The separation of plasma. Which of the following is true about a Robert Jones bandage? A. The bandage can last for up to a month. B. The bandage should always include the toes. C. The bandage contains traction tape to decrease slippage. D. The bandage does not require a large quantity of cotton wool. Answer C. The bandage contains traction tape to decrease slippage. The darkest, or least opaque, parts of an X-ray indicate the presence of: A. Gas. B. Muscle. C. Bone. D. Mineral. Answer A. Gas. When administering an anesthetic to a horse intravenously, technicians inject the anesthetic into the: A. Jugular vein. B. Cephalic vein. C. Saphenous vein. D. Mesenteric vein. Answer A. Jugular vein. The use of piperazine, an antinematodal agent, is recommended in all the following except: A. Cats. B. Dogs. C. Pigs. D. Cattle. Answer D. Cattle. Technicians must often administer medications, such as a hypodermic injection, to patients. When administering a hypodermic injection, a technician may inject the drug using all the following routes except A. Subcutaneous, B. Intramuscular, C. Intravenous, D. Epidural. Answer: D. Epidural. If an adult bovine has 32 teeth, what is the animal's dental formula? A. I06C12P36, B. I66C12P3-43 cubic meters 3, C. I06C02P66M66, D. I36C12P48 cubic meters 6. Answer: C. I06C02P66M66. A correct statement regarding needle holders is A. They are not involved in metal-to-metal contact. B. As they wear, they become blunt or dull. C. They are easily replaceable. D. Large needle holders are required for delicate sutures. Answer: C. They are easily replaceable. Generally, urine samples are collected and stored in A. Glass vacuotainers, B. Plastic petri dishes, C. Plastic sample bottles, D. Glass vials. Answer: C. Plastic sample bottles. Which of the following dressings retains moisture within the wound? A. Dry dressings, B. Occlusive dressings, C. Hemostatic dressings, D. Impregnated gauze dressings. Answer: B. Occlusive dressings. When collecting cerebrospinal fluid, the area of the spine that veterinary technicians most frequently tap is the A. Axis, B. Atlas, C. Occipital bone, D. Atlanto-occipital joint. Answer: D. Atlanto-occipital joint. When performing a venous portography, technicians inject positive contrast media into the spleen or the A. Mesenteric vein, B. Cephalic vein, C. Saphenous vein, D. Jugular vein. Answer: A. Mesenteric vein. Procedures on bigger animals, such as horses or cows, may occur either in the field or in a clinic. Which of the following methods of monitoring a larger animal's status would a veterinary technician least likely use while in the field? A. Personal observation, B. Pulse palpitation, C. A stethoscope, D. Blood pressure monitoring. Answer: D. Blood pressure monitoring. An example of a tricyclic antidepressant used in veterinary medicine is A. Tofranil, B. Ativan, C. Valium, D. Risperdal. Answer: A. Tofranil. Which of the following first aid situations requires immediate medical attention for a member of a veterinary medical team? A. Ingestion of chemical agents, B. Skin contact with chemical agents, C. Eye contact with biological agents, D. Wounds from sharp biological agents. Answer: A. Ingestion of chemical agents. When drawing blood from small animals such as dogs and cats, the vein of choice is generally the A. Cephalic, B. Jugular, C. Renal, D. Saphenous. Answer: B. Jugular. Safin, a steroid anesthetic, is a mixture of alfaxolone and alfadolone. Technicians intravenously inject a dose of 3 to 6 mg/kg in A. Cats, B. Dogs, C. Birds, D. Rabbits. Answer: A. Cats. Emesis may be recommended in all the following cases except 2. A. Empty the stomach before surgery, B. Eliminate a toxin, C. Remove a small toy, D. Eradicate corrosive poisoning. Answer: D. Eradicate corrosive poisoning.